Hi, I'm Dr. Christina, the Picky PT, and today I want to talk to you about core strengthening, but doing it in a position that you may not have thought of being the first position that you did core strengthening in when you entered the gym. So this topic is especially helpful for folks who have trouble pulling their abdomen in and instead struggle with bulging out in their abdomen as they're strengthening their core, doing things like crunches or sit-ups. If you have a history of diastasis recti that you're still dealing with, or if you have a history of back pain, these are great core exercises to start with. If you like the idea of learning more about being picky about exercises and getting the most benefit out of each of them by knowing exactly how you're supposed to be doing them and what you're not supposed to be doing during them, then make sure to like and subscribe to this channel so you can continue learning from me, a physical therapist, how to use exercise to reduce and prevent injury. So, like I said, we're going to go over specifically core strengthening in all fours position today. We're going to go over a progression from the most basic to more challenging of this type of exercise. We already did a video where we were doing strengthening on your back for your core and using props and using resistance to help you do that. But if you're struggling in that position, like I said, with bulging out and not pulling in, then this can be the answer for the position that you should start your core strengthening journey in. So, first level of core strengthening on all fours is going to be putting your hands directly below your shoulders, tucking your feet underneath, all right? And then you're going to do a pelvic tilt, which means pulling your pubic bone to your belly button. Now notice that I didn't do it so much that I'm rounding my whole back. All I did was lengthen my back from about the rib cage level down. So my lowest ribs down to my sacrum, I pulled that in and lengthened my back. Now the next step is I'm gonna pull my core in even more in order to lift my legs up off the ground. All right, so pulling in my core even more, dragging my femurs up off the ground and holding here. This is almost like doing an early plank, but learning how to do it properly, okay? Now, what you're not gonna do, you're not gonna go ahead and shift backwards to achieve this. You're not gonna push forward to achieve this. You're not going to bring your knees to your chest to achieve this. Everything needs to stay at 90-90 and you're pulling straight up towards the ceiling, holding your core in. If you are doing this correctly, you're gonna feel a major burn in these lower abdominals, all right? You would start off with doing this holding 10 seconds and then building to 20 seconds, 30 seconds, 60 seconds, because just like a plank, usually people do that holding for as long as they can. Why do we work on holding? Because the strengthening of your core is what helps you to be able to stand for longer, walk for longer, move between sitting and standing for longer. And so if you want to be able to do that for longer than 60 seconds, then it's good to practice strengthening for longer than 60 seconds too. So this is level 1 of this exercise. Let's move on to level 2. Okay, so level 2 is going to be the exact same exercise, but now what we're doing is we're adding resistance. So I'm taking my TheraBand, I'm wrapping it around my lower back, not my mid back, but my lower back, and then I'm going to get in the same position as before. Hands below shoulders, hips at 90 degrees, feet tucked under, and what we're gonna do is we're gonna do that pelvic tilt. Notice just doing the pelvic tilt, I'm having to push up against that TheraBand. So that's why we have the TheraBand on the low back, so that way it's resisting that movement right there, all right? Then I'm gonna pull that core in even more to lift those knees up off the ground, all right? So again, I'm not letting my knees come in towards my chest, I'm not shifting back, I'm not shifting forward. Everything is staying at 90 degrees, and I'm having to pull up against that resistance. And I'm gonna hold that starting at, again, 10 seconds, building to 20, building to 30, to 60, and then keep building until you are able to, in everyday life, stand for as long as you want to, walk for as long as you want to, bend over and stand back up as long as you want to without back pain. And then you might be ready for level 3. Okay, level 3 of this exercise, like I said, is gonna be when you can do this, level 1, level 2, and you can hold for longer than 60 seconds, longer than 2 minutes, for as long as you want to, and it's not difficult anymore. So level 3 is gonna be the same setup as level 2, where you get your TheraBand, you wrap it around your lower back, and you're gonna begin with your hands below your shoulders like before, hips below, hips at 90 degrees, feet tucked under. You're gonna go ahead and do your pelvic tilt against the TheraBand resistance. You're gonna lift up with that core, and now holding that core, you're gonna step out, Step out, step in, step in. Out, out, in, in. What you're not gonna do is as you do this, you're not gonna let your back arch as you come out. That's a big no-no, all right? You have to keep that core pulled in even as you step out and come back in. One more compensation you're gonna watch out for is as you come back in, you're gonna try to land back at that 90 degrees again, not coming too far in or being too far out, because you wanna come back to your start position again and have to hold that resistance against not only gravity, but now also the TheraBand resistance. So if you're trying to decide which TheraBand to use, you can start with a lower level TheraBand, an easier one, and then build your way up to using a harder one. But you want to be able to choose a resistance level that you're able to do at least 5 to 10 of these in and out before you have to take a break. And that's how you know that an exercise is challenging enough. When you have to do a certain amount and then you have to take a break before you can do more, that's a good challenge. If you're able to do as many as you want for as long as you want, that's not gonna be a good enough challenge of an exercise for you. So we started this progression at level 1, went to level 2, went to level 3. If you are even having trouble with level 1, being able to do this properly without compensating, one tip that I have for you is you can do that level 1 exercise with your feet up against a wall, and that can help you to do this better. You can also do it up against a wall with a physio ball, a larger, medicine ball, between your bottom and the wall, and that can also help you to do this exercise easier. But if you're still struggling and you're not able to pull in and you're still bulging out, make sure to reach out to a neuromuscular expert, a physical therapist like myself, who can come up with a personalized program for you, but also get their hands on you and make sure that you're doing it properly and that you can feel that you're doing it properly. Because remember, that's the most important thing, that you can feel it in your own body that you're doing it properly. Because we're not always going to be there to tell you if you're doing it properly. So you want to be able to feel it in your own body. So remember, reach out to an expert who can help you with this. And if you do feel some success with this and you want another level of challenge for this exercise series, then let me know in the comments and I'd be happy to make an exercise video with even more challenges for you.